coming to the very important part of screening, first thing is that when we're talking about the test itself, it is definitely the DIPSI test. And when you're asking questions to Charmila, talking about RCOG and all, the simple thing was, what happened to these countries when COVID struck? They were nowhere. They were saying, oh, do HbA1c, do only fasting, and they had no clue on what test to do. While we were, like status quo, let's do this one step single test, which can be, even the woman can test the glucometer in her own house, so she did not travel and give blood. That Sushila just told us about the IBGP test, people coming, sitting fasting for 3 hours. In COVID times, nobody wanted to do it. Wherever it is available also, nobody wanted to do it. So they were nowhere. So I think that is the importance of DIPSI test. And I think the other countries, Canadian guidelines and all those guidelines who were at a loss at that time, they should be looking at this DIPSI test and taking it up, because it is something so effective, so easy to do, and something which is very, very doable even in large populations like ours. And especially when you talk about postnatal follow-up, who it's very difficult for a woman to, at 6 months or at 1 year, to leave the child and come and do a test here. So even if it's a point of care system where you're using a glucometer, we have to tell them. And that is one of the things what Anil Kapoor suggested about that bindi on the postnatal card is excellent. But unless we keep on hammering them at every antenatal visit that, okay, you have been discovered to be a GDM, you have to control it by diet and exercise, and if you want to ward off diabetes in future, it is going to be a lifestyle change for you. And then you have to tell them that do this test at at this particular intervals, even after you deliver. So until we push it in the antenatal period, to them, that postnatal follow-up may not happen at all. It happens very little. Even when we do it in our private practice, we are hammering them, do it, still very few turn out. But this is one thing which we have to do at all levels also. And one more small point, if I may, that when you're talking about women's wellness, we are gynecologists, we are dealing with such a large population of PCOS girls and obese girls. So preconceptionally, these are the girls who need to be told that, you're at the risk of becoming a diabetic. Please take care. Please improve your lifestyle. Get into the proper BMI, and that will sort of ward off these diseases in the future.
That question I'm going to ultimately hammer to Sampath Kumari, adolescent. From Jayam, the adolescent baton has been passed on to Sampath Kumari. Now she'll have to, as an organizational leader and the vice president of Foxy, also she'll have to respond to that. Just hold on, Sampath. And Uday, I just want you to quickly, briefly reflect upon, the way we both did the ICOG first study. It was just, so mind-boggling. Just take us through that horrendous journey.
Yes, so it was Hema's idea when we were in ICOG that let's do at least a knowledge, attitude, and practice study, where we realized that people are doing whatever they want, including simple urine sugar, or even, and most commonly test done was random blood sugar, because nobody believed in giving the patient any instructions, nobody at the time. So that was what was being done and we've come a long way since then, because after that, the whole the idea of testing the American guidelines, which were followed at that time. I remember Hema had taken vans into the rural Karnataka and asked the women to come to do that 2-step test, and once 50 grams of glucose, discovered to be diabetic, called back again. The recall rate is poor. Even when the women came back after 1 or 2 samples, they ran away. That how much blood are you sucking, sort of things. So all these were the practical problems which made us realize that no, these tests which are propagated by either the American guidelines or the foreign guidelines will not apply to us. We need something indigenous. And thanks to Dr. Sheshaya at that time, I think Sujata Mishra, Hema, and Sheshaya, and we all discovered that this DIPSI test, which Dr. Sheshaya had done a study there, that non-fasting or fasting does not make a difference if you do a 2-hour glucose challenge, and if it is above 140. So that DIPSI test was the one which we clinged on to. We have done so many validation studies. We have realized it is more or less the pickup rate is similar, more if not less, and it is something which should be done throughout our country as a uniformity. because like Sushila said, that IIDGP test also is not easy to do even in private practice. So I have switched over to DIPSI test for the last 10, 15 years or whatever, and everybody gets screened for this glucose challenge, irrespective of whatever their BMI is, etc. And I think it's something which is so valuable that we should be now telling the world to do the DIPSI test, because now COVID has taught us a very, very good lesson. And I think Usha has a fantastic paper, The Sweet Spot, what she's got. And it's a lovely read what Usha has got. And it really focuses on the DIPSI test so beautifully.
Yeah, thanks, Uday. And